All right. I think we made it through the morning's lineup. And so we're going to head into our first session, which happens to be my session. So I'm going to keep talking at you, I guess, for the next hour or so. We're going to learn more about United Spay Alliance. So just so everyone knows how this is going to work, as we present sessions, you are going to hear the speakers, but you are not going to be able to see their webcams. We do keep webcams off for the duration of the presentation. And then you'll hear the speaker, you'll see their slides, and then we will turn webcams on at the end for the Q&A portion. But for the moment, you're just going to be able to uh, hear me speak. um, and as we get started with our first session, I am not going to tell you too much about my own bio, other than to say I am the administrative director for United Spay Alliance. I have been with the organization since about 2020, I believe, and helping support the day-to-day operations and helping run some of these programs that you're going to hear me talk about. And I have had a fantastic experience getting to know all of the people and the organizations that USA works with, and getting these programs to where they are. My background, I did start I guess, with AlleyCat Allies in 2013. That was my first foray into this sphere. Working in that community cat part of things. And I was with them for a number of years. I worked with their National Feral Cat Day campaign. I worked with the Feral Friends Network. And I got to know a lot of wonderful groups that way. And so when I just happened to partner up with Stacy LeBaron coming out of Alley Cat Allies, and then one thing led to another, and here I am working with United Spay Alliance, and fortunately working with a lot of the same people I knew back then. I've just been able to evolve those relationships and keep talking about spay neuter. So it's been a really wonderful journey. And I am excited to tell you what we've been doing. I think you'll like it. And then also during the presentation, you're also going to hear from Cheri Storms, who is the chair of our Veterinary Shortage Task Force. And so I will read you her bio. Cheri is the executive director of Pet Friendly Services of Indiana. She made the jump from environmental policy work to animal welfare, joining the board of Pet Friendly Services of Indiana in 2005 to help grow the grassroots organization. Within 5 years, Pet Friendly Services obtained a specialty license plate, providing the organization with the needed revenue stream to fund spay neuter surgeries across Indiana. Pet Friendly Services now has a network of 125 vets and provides financial assistance to shelters and rescue groups, as well as to limited income pet owners. Due to the need to stabilize outdoor cat populations and decrease shelter intake, Cheri launched the Community Cat Program to financially support organizations that trap, neuter, return feral and free roaming cats. As a result, Indiana increased the number of TNR programs from 25 to more than 150. The paperwork involved in running a statewide financial assistance organization was ever mounting. Cheri's team responded by fully automating their processes, allowing pet friendly services to run more efficiently and expedite the spay neuter certificate process. Automation also included vet reimbursement, allowing participating vets to easily invoice pet friendly services for their work. And that is Cheri Storms. She's one of our board members. She's the chair of the Vet Shortage Task Force, and she's going to tell you all about that work and what that means. I'm going to just move into the presentation. And so this is all focused on United Spay Alliance and what we've been up to, and a big, how we think of it is putting spay neuter back in the spotlight, where it of course belongs. So without further ado, let me go ahead and get my screen rolling. There we go. All right, and so I did want to start this session just by framing spay neuter and how we think of it. And that is that spay neuter is public health for pets. And if you're familiar with the terminology and thinking around public health, it's all about prevention, right? Preventing the suffering of tomorrow. And so at United Spay Alliance, we know that spay neuter is essential. It is one of the most powerful tools we possess to protect pets and their families by preventing unwanted litters, reducing the risk of disease, and easing the burden on shelters. We are safeguarding the future of our communities. And so that's how we approach it. It is that important to us. It is so important that the entire organization is focused on this single issue. And just from the diversity of our programs and how we're coming at it, I hope it's evident how layered and complicated such a seemingly simple and obvious thing can be. But this is it. This is spay and neuter is paramount in all the things that we do when it comes to animal welfare, animal rescue. Spay and neuter is at the peak. And so here's how we're going to approach our session today. I am going to talk to you a little bit about what's happening around the country. We're going to check in with our state leaders to see what things are like in their communities. I will talk to you about what United Spay Alliance is up to and what's on our horizon. And then, of course, we're going to wrap up with how you can help. And so very simply, that's how we're going to move through. I do just want to point out this photo here. And so our founder, our president, Esther Meckler, has been involved in this work since the 90s. I want to say 90s, if not earlier. And so she will often send me photos of her just different times over her career and work in this area. And so she sent me this one of the Mississippi Spay and Neuter Conference back in 2005. And so it's one of the earlier like gatherings of folks in a room talking about spay and neuter, right? It's one of these focused conferences all about spay and neuter. And the excitement on everyone's faces having made these impressive connections. And so I just want to say that everything that we're doing, we are standing on the shoulders of folks who have done it before, right? We are definitely we're carrying the torch forward. People who have come before have figured some impressive things out. And so at United Spay Alliance, we don't think anyone has to reinvent the wheel. This wheel's been a churning for a good long time now. And so we are all about making connections, empowering folks, sharing tools, sharing resources, to keep things moving in a positive direction. So bonus, if anyone out there in the audience today happens to be in this photo somewhere, please let us know. Drop that into the chat. It's outstanding. And so thank you so much to everyone who came before and has been in this issue and been furthering these causes. We are glad to keep pushing along today. So I am going to start us out with a couple of poll questions because I don't know if you noticed, but I like some polls. And so I do have a question for you. I am wondering if you could tell me what is the average cost of quote unquote low cost services where you are. Now I ask this question because it is an ever changing bar, I think. When I first started at USA, we were trying to say that low cost was anything under $100, but I think that number has changed. I've since kind of bumped it up to 150. It just kind of depends where you are. So this is for cat spays. And so just so we can easily compare apples to apples, I'm asking specifically about cat spays. If you happen to know, go ahead and pop that into our poll here. All right, I'm going to give you a couple more seconds, get those votes in. I'm going to close it in 3, 2, 1. All right, very interesting. All right, I don't know if y'all can see these. Let's see. No one fell in that 25 or under category. We have just 8% of you saying that you fall between that $26 to $50. 64%, so the overwhelming majority seems to be somewhere between $50 to $100 for a cat spay. 26% of you are paying over $100 for a cat spay. 3% of you are paying over $150 for a cat spay. Oof, all right. So that's helpful. That's helpful information. Because I know we're all wondering, is this normal? Is this what it costs? So I do have one more question for you. If you had, I'm asking you, so if you had to answer, how does access to low cost services today compare to how it was like a year ago? In your opinion, right? This is just anecdotally on the road to affordable spay neuter services. Are we in a better place, or are we in a worse place? Are we in about the same place compared to where we were a year ago? Cool. All right, so is it much better, somewhat better, about the same, somewhat worse, much worse? Hopefully not too many say much worse. All right. Give you a few more seconds, please. I appreciate your input. And so this is just helpful for us understanding the landscape around the country, what folks are facing. All right, 3, 2, 1, and let's share those results. And so 5% of you are saying that it's much better than it was a year ago. That's fantastic. 2% are saying somewhat better. Love it. 55%, so the majority of folks say it is about the same, which I guess is better than the alternative. And so I'll take about the same, sort of a plateau. 26% are saying that access has gotten worse, when 12% are saying that it's much worse. And so, oof, all right. So we are seeing that it is different, and so much depends on where you are. All right, there we go. Oh, there's my poll slide. So I am curious, and I'm always curious to know on behalf of United Spay Alliance and others, what is spay neuter like in your state, wherever you're located around the country. And so I turned to our state leaders, and we'll talk more about what our state leader network is in a few slides from now. But I turned to our folks around the country and I asked them these three questions. And I invited them to say as much or as little as they would like. And so what is the spay neuter landscape like? How accessible are low cost services? If you could give me a number for what low cost even means to you, and are things better or worse? And so you'll see I made a little key, because what you'll see on the next slides is there's like a little bubble that has some pricing. And so basically, if they provided pricing info to me, I did include that. I was as transparent as possible. I included cats, I included dogs. If they broke it down for me, I broke it down for you. So here we are. I'm sharing information, and now these are not in any particular order. It's really just how they hit my inbox, as far as states go. But in South Carolina, our Humane Society of South Carolina and our state leader Dawn said that they are still experiencing shortage, especially in rural areas, of low-cost spay neuter services. The biggest hurdle is veterinarians willing to perform the surgeries. Let's see, there are nonprofit clinics in the state, but some of them are as high as the regular clinic. And then they gave their pricing for dogs and cats. There are cats between $50 and $80, dogs between 100 and 140. And then turning to New York City and Long Island, shout out to the Mayor's Alliance. Pet surrenders resulting from owners' inability to afford care, particularly with regard to veterinary care, have increased. Accessibility is woefully inadequate to meet the increasing demands. Private vet clinics are charging up to $1,000 for spay-neuter surgeries. In my experience, the situation has worsened. Now, he reported that if you could find anything under $200 for cats, you were going to be a very, very lucky person. And so more often than not, that low cost, quote unquote, is going to be between $200 and $500 in New York City, which is ridiculously high when you consider low cost. And I will say that New York City, they recently brought everyone together. They had like a day-long session with their council, the New York City Council, to talk all about this issue and access to spay neuter and access to services, and how the burden has fallen to these nonprofit rescues and volunteers who are paying out of their own pocket. And so they had this day-long appeal basically to the council to try and convince them to put their money where that needs to go to support the community and stop asking their rescues to shoulder that burden alone. And so I, shout out to the Mayor's Alliance for their role in that, and everyone who came together. That was a very interesting. It'll be interesting, I guess, to see the result of that day-long session. And down in Mississippi, we were hearing from our friends at HARP. Many of the 20 counties we serve do not have low-cost options. Some of our clients drive hours to use our vets, and HARP pays for the spay neuter. We have many more to fix on the list than we have appointments or the funds to fix. Things are worse this year. And so I have a few of these slides to go through. I won't read through absolutely everyone, but I think if you have a trained eye, you can pull out some very common themes. Over in Delaware and Humane Animal Partners, shout out to our state leaders there. There are 4 main animal welfare organizations in Delaware that provide the bulk of low-cost services, but they are located in Newcastle County. The other 2 counties are more rural and have limited access to low-cost spay-neuter. And now the range that they gave us in Delaware was anywhere from 65 to 325. I'm not sure how that breaks down between dogs and cats. I imagine dogs are going to be on the higher end of that. Julie Jacobson in Spay, Tennessee, just a rock star of an advocate for spay neuter, really leading the charge in Tennessee and has been for years. Shout out to Julie Jacobson. She said that low cost services are pretty accessible. Only 2 of our 95 counties are not covered by a program of some kind. Things are probably better overall. The biggest problem is the struggle for funding. As grantors have moved on to wellness. This is exacerbated by the fact too many shelters and rescues still adopt out intact animals. And that delves into the issue of neuter before adoption. And I will note that United Spay Alliance feels very strongly in enforcing neuter before adoption. We have a whole Q&A panel webinar available on the topic if you want to check it out over on our YouTube channel. That's a whole session in and of itself, so we won't dig into that. But yes, we agree that neuter before adoption is a very, very important piece of this puzzle. We also heard from our friends in New Jersey, who is one of our newest state leaders. So we're very grateful to Amanda and CPAW New Jersey for being a part of our network. They were saying that a vet considered affordable recently quoted a private client $600 for a cat spay. Low-cost services are less accessible all the time. The low-cost leader in North Jersey just increased their prices from 80 to 90 for their TNR package. Things are definitely worse. One low-cost clinic has closed completely, and the other has increased its prices. I think I have a couple more slides. But Pennsylvania, Frankie's Friends, Dr. Morrow is again, another outstanding leader, a veterinarian who runs a clinic out there called Frankie's Friends. Low cost averages for cats are $70 a spay, $60 neuter, and between $150 to $200 for dogs. There are not enough services for those in areas that are not close to Pittsburgh in the western part of PA. We have people traveling an hour or more to come to us with their cats. Over in Iowa, we are still without a full-time veterinarian. We now have 10 part-time veterinarians. It's made a huge impact having these part-time vets, but we absolutely have the capability to do more if we could just hire someone full-time. In Colorado, the need for spay neuter is still high, but some parts of the state are meeting that need better than others. Low-cost services are fairly accessible for people willing to travel to bigger cities. So again, anyone noticing some themes here? In Kansas, things are worse this year than last. Topeka Community Cat Fix, our state leader, has over 1,000 cats on the waiting list. There are a few low-cost options, but not enough. The Humane Society had to stop doing low-cost spay-neuter surgeries for several months because they didn't have enough veterinarians. In Massachusetts, there could be a 6-month wait list for spay-neuter surgeries, especially for those seeking low-cost services. We're also seeing housing issues and high veterinary costs, which are impacting access to services. Low cost is now at least $100 to $125. Things are as bad or even worse than they were a year ago. And in Washington State, I made sure to include a photo that made it very clear we're in the Pacific Northwest. Washington State, spay neuter is vastly different depending on where in the state you are. For the Seattle area, we have several orgs. We are all wind up spaying and neutering animals from all over the state since there are so few options in the more rural areas. Big dogs are an issue because so few places spay and neuter them. In a way, it feels worse than last year. Our inbox is always full. And so the themes that I pull out of everything that I hear is that if you are in a major city, then there's a good chance that there's probably a resource out there for you. However, if you do not live in that quote unquote big city, whatever that is in your state, if you're in a rural area, you're going to have to travel. Odds are you just do not have a low cost option in your immediate area. You're going to be traveling an hour, 2 hours, maybe more. And that places who are set up to do work with, provide these low cost services are struggling because they cannot find veterinarians to work full time, or possibly they cannot find vet techs or other support staff and other office staff because it takes an entire trained team to make these low cost clinics run. Veterinarians are an important piece, but they're not the only piece. And I have certainly heard of places who are limited in what they can do because they just can't find vet techs or even, a clinic manager. These are just as important to making things run. And so those are the themes all around the country. I don't know if those resonate with you at all, but if you were thinking that you are alone, you are absolutely not alone. We're seeing it everywhere. Things are starting to improve in certain places or have improved, but certainly not everywhere. There's more work to be done, which is great because we're out here doing the work and you're all here with us to hear what we can do about it. So getting into our programs and what United Spay Alliance does, we do have our spay neuter directory. And I tend to think of this as like our bread and butter. This is like the backbone of our organization and what we offer. I think it was probably the thing that we offered when we first came together was this directory of services, of low-cost spay neuter services. At this point, it is an online. You can go onto our website, you click on Find Spay Neuter Help, and you'll get a map, and you click on your state, and then you can input your zip code, and it'll pull up a list of places that are within a certain radius of you. And this is something that we are constantly researching, auditing, updating. We want this list to be as up to date and accurate as possible. And so we are just constantly on the lookout for new resources. If you do go to our website and find that something is missing or could be updated, there's a link in the bottom left hand of your screen that I do encourage you to use. Also, I did put together, by the way, as I run through all of these programs, I did put together in one of those handouts that you can download. There's like a quick links guide where I've just hyperlinked everything for you. I think Kristen put it in like the front of the packet too. So it's like a long bullet point list of different hyperlinks for you to explore. And I put that together to coincide with this presentation. Because I'm going to tell you about a lot of things that we're doing, and instead of you having to scramble and take notes, I wanted to make it easy. So that quick links document is in your handouts. But yes, so we always encourage the public to let us know if something on our directory should be updated. You can do that using that link at the bottom, because we keep it as current as we can. And so every time someone submits a change, we make an update. And that we are also starting to include additional resources that, obviously anyone looking for low cost spay neuter could possibly benefit from a pet food bank, or maybe they need some TNR help or financial assistance of some kind. And so as we continue to research what's available in every state, as we come across these additional resources, we're throwing them in there as well. So our focus is low cost. And again, what defines low cost, I think, is that moving bar. There's a lot of gray. Unfortunately, there's no black and white answer that I can give as to what is defined as low cost. I think that's always going to come down to the area and what people who are using this list feel they can personally afford. But we are doing the research to see what at least is out there, so people have a starting point when they can, that they can start using to call places locally, right? And so we're building out this directory, and it is bolstered by our state leader network. And so you were just hearing a little bit from our state leaders, these folks around the country, about what spay neuter is like. But our state leaders are really, for the public, they're there as a resource. And so we have our map, and then the state leaders are sort of that second layer. If folks can't find the information or support they need using this map and all the other resources we provide, our state leaders are there to help close the gap. Whatever that extra challenge is, they're there to help that person overcome whatever obstacle, so that they can go ahead and make that appointment and get their animal spayed and neutered. And so for the public, they're providing a very, very valuable service. But then also internally, our state leaders, we bring them together to create a network. Our state leader network. And so I think I've mentioned before, but I mean, it's even in our name, United Spay Alliance. We're all about relationships. We're about bringing people together, because we think that we are far stronger together than we ever are apart. This work, it takes a village. No one's going to solve spay neuter on their own, right? We all have a part to play, and we are here to help build networks, foster collaboration, and we really aim to empower folks, make sure they feel like they have the resources they need to be successful. And so we bring our state leaders together. For instance, we have a quarterly call where we bring everybody together to talk about whatever the important issues are of the day, so to speak. We are also able to do some like grant prospecting. We send funding opportunities anytime they come along. If we have talked to someone that is trying to do something that we know so and so has actually already started that license plate program, or has started a tax to fund spay neuter surgeries off of the price of pet food, whatever that is, there's odds are we know someone who has done it, and we put people in touch with one another. And so we're very much here to support our state leaders and help them be as successful and make as big of an impact as they can. And so we are very glad to say that right now we have 40, and actually as of last night, we have 41 state leaders. We have a new team coming on for the state of Oklahoma, so we're very grateful to them. I just got that good news in my inbox late last night. But altogether, so we have about 40, 41 states covered. We have 56 contacts on that list. And so in some states, we have like our state leader, and then we have like the state leader support team, so we have multiple contacts, multiple organizations that we are in touch with. We love making friends. We love making connections. And so if you were to put it on a map, so this is where we were last year. And if you attended this conference last year, you probably heard me talk about the Go Green campaign, which was our concerted effort to make every state on this map green, which means that they had spay and neuter resources for our map that I talked about, that directory, that we had researched a list of resources for the state, and then they would flip green when we also had a state leader. So it means that they have resources on our directory and they have an appointed state leader. And so this was a year ago. This is my favorite part. Ready? Drum roll. Brrr, bing! Here we are, October 2024. Pardon my very lame drum roll. All right, so we have all of these states in green. Like I said, Oklahoma, I think we are able very soon to flip that once we make that official. We just brought on New Jersey. We just brought on South Dakota. We're constantly trying to make friends and find other places in these other states to join us. And so we've done a lot of work to get to this point. And we're gonna keep doing what we do to make new friends and build those relationships, because we really do think that building networks is so important. All right, so that is our state leaders, our spay neuter directory in a nutshell. Just high level talking about wet labs. If you are interested in anything I say in this next slide for our wet lab program, I encourage you to stick around. Our next session is entirely focused on wet labs. We're going to talk to some folks who have hosted these trainings, and I'll give you a bit more detail as to what hosting a wet lab entails. But for the purpose of this presentation, at a high level, we are facilitating trainings for veterinarians. And so these are for licensed veterinarians to attend a one-day training to get hands-on experience with spay and neuter surgeries using high quality, high volume spay and neuter techniques. And I do want to just pause for a moment and say that we do emphasize the high quality piece of it. If you've been in this space at all, then you might have heard that even there are veterinarians out there, there's some misconceptions out there about what low cost services are. And there's this real idea that, oh, well, you get what you pay for, and that somehow that these services are less than. When in fact, the techniques that are utilized are they're highly efficient. They have been applied and refined, for decades now. The outcomes that surgeons see when they apply these techniques, I mean, it's less invasive on the animals. I mean, if you just think about incision sites, everything, I could go, and I'll go into detail in the next session about why we're so excited about sharing these techniques. But I just want to emphasize that language matters. And so we do emphasize high quality, high volume spay and neuter, that these are techniques that are better for animals, they're better for the patients, they're better for veterinary teams, and that they're shorter, not because anyone is cutting corners, but just because every single technique, every maneuver is so purposeful and it is highly efficient. And so you're saving time and money through efficiency, not through cutting corners. Anyway, I'll get off my soapbox there. But we do have these trainings that we have been putting together. We're very excited about them. We are putting them together at the local levels to make it easy for veterinarians to participate. They don't have to travel to another state. They don't have to be away from their families for multiple days. They don't have to pay whatever you have to pay in order to be licensed in another state. And licensing is an issue in of itself. And so we've made them as easy to attend as possible. I think registration is just at $150, so it's a really low bar, and you get 8 hours of CE. All of our trainings have been approved for continuing education. So by the end of the year, we will have facilitated 10 wet labs in 5 states and provided training to 43 veterinarians. And that's since our first wet lab in April of 2023. So coming up on, a year and a half or so of hosting these wet labs. We're very, very glad with how they've come together so far. And again, I would love to tell you all about this program in the next session. But just to let you know, not only do we think they're exciting, but the veterinarians who attend them think they're pretty exciting. And so we do have some beautiful testimonials. I won't, dig into it, but the day was wonderful, amazing experience. This course was amazing. And I'm not lying when I say that the evaluations we receive, and every student so far or trainee so far has submitted an evaluation. Whether they sign their name or not is up to them. But we always receive top marks. We get a lot of 5 out of 5s. I think it is rare that anyone has given us, less than a 5, and in that case, it was probably a 4. But and we owe all of that to the teams that we're working with, to the trainers that have come on board to teach across the country. But so far, we're enjoying what we are seeing with this program. All right, so I've been talking at you for way too long. I'm going to invite Cheri to unmute her mic, and she's going to walk through the Vet Shortage Task Force.
Thank you, Bree. So the Vet Shortage Task Force launched in 2021 because it was the elephant in the room. We knew that it was hampering our efforts to spay neuter. So just some background information on it is that it's expected to get worse before it gets better. And the reason why is that for 30 years, the US only added 1 new vet school, yet the American population doubled during this time. So we're currently on track to have 11 new schools open, but it's going to take years to graduate students. It might take a year or 2 to get the school open, and then 4 years of training. So that's 5 or 6 years down the road. Meanwhile, the US is losing about 7,000 vets per year. And these estimates vary, but they're all kind of bad. There's retirement taking place, and there was burnout. And then at the same time, we're adding about 3,200 new vets graduating each year. So we're at a net loss. And the rural areas, as Bree has discussed and others, are hit especially hard. When you think about it, if a vet retires and sells the business, there's no one to take it over because there's nobody living in that area that's a veterinarian. And for veterinarians that live in cities, it's unlikely that they're going to go live somewhere that they're not used to. So it really puts the rural areas at a disadvantage for years to come. There are a lot of stakeholders that are harmed in this vet shortage, and a lot of us are very aware of it, but some are not. So the veterinary professionals, they see it, they know it, they live it. The high quality, high volume spay neuter clinics are struggling to get enough veterinarians. Shelters, rescue groups, community cat programs. We are overwhelmed with animals and backed up to get appointments. And then the animal control officers and public safety officers are seeing it as well. But what we are hearing is that city, towns, and counties that are paying for sheltering, we're hearing that they're frustrated and they can't understand why the shelter is not adopting out more animals. And we're hearing that they're frustrated because of the price tag of this, and that they're also seeing more free roaming dogs on the streets because of limited intake shelter policies. So they're frustrated, but they don't understand what's taking place. Health departments, we're not sure how many of them realize that when an animal gets fixed, that's usually when they get their rabies vaccine. And so with a lack of spay neuter, we're having dogs roaming the streets that are unvaccinated, and just a lot of animals in general that are not vaccinated. And even the corporate and private equity firms that are purchasing vet practices, even they are frustrated. They're trying to add more vets. Bree, did you want to go ahead and change that? Thank you. So the Vet Shortage Task Force, we thought it would be a lot easier than it has been to make any headway. And so the role of the AVMA, it has refused to admit there's a veterinary shortage, yet it's heavily involved in all aspects of the veterinary profession. And so without their cooperation, the veterinarians are powerless to address the crisis. So Bree, you will have a couple of handouts. Oh, you've got there down at the bottom, learn more about the vet shortage and what the creative solutions are.
Sorry, yeah, in the handouts, there's a whole background document for folks, I think, that Cheri put together. It's a beautiful document that goes over all of this.
Yeah, so as I said earlier, we thought it would be a lot easier. So we put a background document together saying where we've been, where we've hit hurdles, and now why we are pivoting to Plan B. So we can't make more veterinarians because we have so many barriers, but we can bring more high quality, high volume spay neuter veterinarians into the fold. So the trainings that Bree just talked about, the wet labs, that's the entire goal is to increase capacity for spay neuter. And Dr. G talked yesterday, and she's got some great internship and externships for vet students, as does Dr. Morrow. So that will add capacity as soon as the students graduate, and even during their externships. And the other thing that we're doing is tracking and implementing new legislation. So the landmark reciprocity bill in Florida is a direct result of the Vet Shortage Task Force. Dr. Whedon is a retired veterinarian. He's a Hoosier. He's from Indiana originally. Florida licensing requires it requires a temporary license or a permanent license to practice in Florida. So we were wondering, how do we get more snowbirds that retire to come to Florida to practice and to do spay neuters? And so Dr. Whedon just trotted his butt over to Tallahassee and started talking to people and got a bill going. The local ASPCA rep jumped in, and they got a new law. And so it wasn't everything that they wanted. It is, and I'll talk about that, I think, in the next slide. So we're working on that and tracking other types of legislation. Telemedicine and those things are very popular. And then we're also working to remove barriers to spay neuter and to encourage communities to invest in spay neuter. And those two things are ongoing, as is all of this. So legislation, so reciprocity that I just mentioned, that is licensing. So vets are licensed in certain states, and every state has different licensing requirements. Some allow vets to come in and practice, others do not. Some require a temporary license. It can take weeks and cost hundreds of dollars to get a temporary license. That's why it's so important to have wet labs in states so that they can train their own vets and that those hurdles are removed. So we're working on that. The Florida bill allows vets to volunteer to sterilize cats and dogs. It's not exactly what we wanted. We wanted them to be able to be paid, but it's a really great step. And it also allows vets to come to Florida for training. And that's why you've seen the wet lab star on Florida. We're also looking at telemedicine as a way to free up vets and get more access to care. We're looking at veterinary loan forgiveness, and then even helping foreign trained vets through the clinical proficiency exam. So there are a lot of vet schools that are not in the United States. They're they're in the Caribbean. When those vets graduate, they have to take a different test than the kids here. And so it makes it very difficult for them if they don't have access to the ability to practice while they're waiting to take the exam. And there are only a couple of universities that administer the exam. So the vet students might wait, the recent graduates might wait for a year or so before they can even take the exam. New Hampshire recently introduced a bill to help foreign trained vets through this exam because they realize there's a vet shortage and they want more vets. And then the Veterinary Professional Associate, this is something that everyone is talking about. Why don't we just do this? Why don't we just get vet techs to work at a higher level? We would love to see that. We would love to see them being able to take the burden off the veterinarians. So right now there are 3 schools that are offering a veterinary professional associate degree, and they're listed here, Lincoln Memorial, and they have several locations, University of Missouri and Colorado State. So that's really wonderful that they're offering these degrees, but the flip side is that is that state laws prevent vet techs from working um, at this level, and there aren't laws in the Vet Practice Act for this type of professional, the veterinary professional associate. So it's really interesting in that the states are seemingly pushing for more than the AVMA is willing to give. So we're going to see how that plays out. And then there's just more to come. So everything that we're doing, we're looking for every opportunity to add more vet capacity and more veterinarians and to help veterinarians. So we're just going to continue pushing the envelope until we break through. So stay tuned for more. And Bree, I'm going to give it back to you.
Thank you, Cheri. But yeah, as you can tell, we're doing a lot with the Vet Shortage Task Force. I mean, that is just a couple slides to talk about a whole heck of a lot of work. But yes, in your handouts and in the quick links guide, you'll see links to the different landing pages on the Vet Shortage Task Force. You'll see that background document that provides a lot more of the context and research that was done to kind of frame the issue and why it's so important and why we're going about things the way that we are. So again, just take a look at those handouts for further reading. But turning to some of our other programs, I think at the very top of today's show, we talked about Feline Fix by 5 as one of our sponsors. But this comes from the fact, which I simply didn't know before I really sat down to think about it, but vets really aren't taught the best age to spay and neuter kittens. There's no just standard recommendation recognized by the vet community. And so there is a lot of science, there's a lot of reasons to say that fixing before 5 months is the ideal. And so task force came together back in 2016, offered these recommendations. Those recommendations were endorsed by the AVMA. And so Feline Fix by 5 came together as a way to promote the findings of that task force and to get more veterinarians to fix by 5. And so we do recommend 5 months because we know that cats can get pregnant as early as 4 months. And so by fixing before 5, you're going to eliminate a lot of those oops litters. And this is, we also hear, obviously, a lot of you here today might be with a shelter or a rescue program where you're doing spays and neuters much younger. Fantastic. You know, we know the 2 months, 2 pounds, that's outstanding. However, Fix by 5 is largely targeted toward like private practice or, you know, veterinarians who are working with owned cats where their owners might feel like they can wait longer and longer to have their cat spayed or neutered. And so if you're fixing much earlier, if you're on the 2 pounds bandwagon, that is terrific. You're certainly fixing before 5 months. But this is also to invite everyone else out there to also join the bandwagon of Fix Before 5. And so you can learn more at felinefixby5.org. I don't know if y'all know this, but United Spay Alliance also has a podcast, again, partnering with our sister organization, Community Cats Podcast. We thought it was a great idea. So we are doing monthly episodes. We launched, I think our first episode actually launched in like December of 2023, but officially we launched in 2024, and we are in the process of recording our episodes for 2025, and so we're looking forward to another exciting lineup of great content. But these are really conversations with people who are doing some cool things in the spay neuter space because we want to share their stories. I know, like, if you're like us, you want to know how they did it. We want to know what their secret sauce is, right? We're all looking for what is the answer, what is the thing, how can I make this happen for me? And so we're sharing their stories. We're letting them tell you in their own words how they did it and what they recommend for you. And so we're aiming to inspire, empower, provide you with a little something to get you through your day, I guess. It's episodes are just like 20 to 30 minutes. And so if you haven't checked it out and looking for a little something inspirational to add to your listen list, I would go ahead and check out United We Spay. We're on whatever platform you like to listen to your podcasts. We are there. You can also find us on YouTube. We do also have our Community Cats Grants program. So if you attended our bonus session yesterday, you've heard all about this. But we do have the Community Cats Grants program aimed at building the fundraising capacity of grassroots organizations. And so these are really organizations, like if you are all volunteer, if you make like $50,000 or less in revenue, I think our cap is at like 150 in revenue. And so these are truly grassroots groups. And you want to raise money to spay and neuter outdoor cats, I encourage you to go ahead and check out our Community Cats Grants program. We just kicked off Group 20. We just had a call earlier this week actually with a Group 20. And so the next deadline, we will have application deadlines March 31st and then August 31st of 2025. And so go check that out if you are a group that could use some funding for outdoor cat spay and neuter. And then we are also building resources, or we have resources that are available. We have a spay neuter training page, and that is a place for all things relating, obviously, to spay and neuter training. And so whether it is in-person trainings that we know of, I think we've added online resources. I think we've even started to add externships for veterinary students to get their hands on some spay neuter training. And so this is an evergreen page, I should say. It's something that we are updating anytime we find a new training resource. We have videos from Dr. Bushby where he actually records how he does these different techniques. So if you're a veterinarian and you want to see how a certain technique is done, a different knot is tied or whatever, we have those videos on that landing page. If you want to find resources, I mentioned our state leader in Pennsylvania, Frankie's Friends. They also have a wonderful training program. Dr. Becky Morrow, they have an in-person program, but they also have an online program that is race certified, and it's training for veterinarians, but they also have training for vet techs and the rest of the clinic team in high quality, high volume spay neuter. And so that's Frankie's Friends. You can find that information on our spay neuter training page there listed for you on your screen. We've also put together a blog series on delivery systems for low cost spay neuter that kind of review different things like a stationary clinic, a mobile clinic, a MASH clinic, public-private partnerships, all those different, kind of creative strategies to incorporate more accessible spay neuter in your community. We have a blog series on that where we talk to different folks who have done it. Again, trying to give you the secret sauce for how you can do it too. And we're constantly building out, we're recording new webinars. We just recorded a webinar at the end of September with Dr. Murtaugh talking about the veterinary professional associate role that you just heard about from Cheri. And so we recorded that webinar where he told us more about the VPA position and what that's looking like. We're recording, I think we're aiming to have some quarterly webinars with timely topics for you throughout 2025. We're here to provide content, right? We want you to have the tools, the information that you need. And so definitely check out our webinar library or our YouTube page. So where do we go from here? Like I've talked a lot about what we're doing. So what's on the horizon, right, for 2025 and beyond? That Go Green campaign, I am still determined to get this dang country all green, right? We have 41 leaders right now. I would love to see more states flipped green. And so we're going to keep growing, keep networking, keep building relationships. And just because a state is green doesn't mean we can't make more friends. And so we are always having, I call them getting to know you chats, where we just kind of cold call people, and see if we can line something up to get to hear a little bit more about the work that they're doing and how we can support them. So we're always building out that Rolodex. We're going to be hosting more wet labs, which again, if you want to hear more about that, we can talk in the next session. But these folks here that you see in that picture, that is our team from DeKalb County, Georgia. They just hosted one of our most collaborative wet labs yet. They got the county involved, the GVMA was involved. It was a really great event. And they're going to be hosting a dog wet lab in February. We also have a team in Oregon that's going to be hosting a wet lab in February. And so we're kicking off 2025 with more wet labs and looking forward to adding more to our calendar. And like I was saying about our webinars, we're looking to just continue offering more webinars, more blogs, more podcasts, more everything that makes sure that we have the information readily available on our website for anyone, anywhere that wants to access spay neuter information. We also recently launched our Spay Vet Net. And so, again, networking, it's a theme throughout all we do here at USA. We are specifically reaching out to experienced, high quality, high volume spay neuter surgeons. And these surgeons can sign up. And the idea is that they can be on our list as trainers if we do need to call upon them, to see if we can use their help with a wet lab or similar training. But they're also there to be mentors and advisors as we continue to work through the vet shortage and our different approaches to how we get spay neuter into different communities. And so we are building this network of surgeons, the folks who are, putting their hands down to do the spay neuter surgeries. We are building a network of them. And when I say we recently launched, like literally within the past few weeks, started putting it out there and asking folks to join up. And we already have, I think it's like 92 people on our list. And so I think we're doing pretty good for just having launched that. And our keeper of the flame task force, and this is our newest effort, I think. It just came together. We're pulling people together to answer this question of how do we inspire and empower the next generation of spay neuter advocates? How do we put spay neuter back in the spotlight? How do we make sure that there are people there to carry the flame into the future? And so, again, another wonderful picture from Esther from 2014. We are standing on their shoulders to keep fanning those flames and moving forward. And so we have that Keeper of the Flame Task Force, and we are going to continue to do our best to be a national voice for spay neuter, a national voice for spay neuter, and for the advocates all around the country. And so we are technically national, but we still very much want to be tied into the grassroots and what we can do to support you, everyone here who is tuning in, all of the folks on the ground who are doing the work, what is it that you need and how can we help meet that need? And so as we wrap up here, I do want to say, how can you help? If you are wondering, how can you plug into the work United Spay Alliance is doing? Of course, you might want to consider hosting some sort of training. Our wet lab program is designed to create templates so that anyone could go out and do this too, with or without United Spay Alliance being involved. You don't necessarily have to have us along for the ride. If you want to do a training, we want to give you the tools to make that happen, or you can partner up with us. Like I said, we're building out our calendar for 2025 and beyond. You can explore those delivery systems that we talked about. Can you host a MASH clinic? Is a public-private partnership right for you, or is it some combination? It never hurts to take a look and see if there's something in there that might just be the right answer for you and your community. And then always continue building your network. It never hurts to have people you can call, when different things are happening. And so if you're a TNR group, please make friends with the rescue groups in your area because you're going to find kittens and you're going to need somewhere for those kittens to go. And so partner up with those groups, complement each other, don't compete with one another. And so, and these two folks here, I do want to just give a shout out to Dr. Mackey. He is a board member emeritus here at United Spay Alliance, critical member of the spay neuter movement getting to where we are today, along with Craig Nielsen of Spay Mexico. These two folks are really rock stars. Craig is in Mexico with Dr. Jeff right now, actually hosting that clinic that Dr. Jeff talked about yesterday, where they are spaying and neutering, I think, like 800 animals this weekend. Ooh, Spay Mexico and Spay Panama. We have them featured here. They're doing some really, really great work on the Spay global front. All right, so that brings me to the end of the presentation. At this point, I'm going to take a breath and I'm going to ask Kristen if she can come on, and maybe Cheri, turn your mic on, and we'll be here to answer a couple questions.
So, first question, why aren't high quality, high volume spay neuter techniques being taught in vet schools just as a standard to new vets coming in?
I think, I will say for my part, and I don't know if Cheri will have a different answer, but there are many ways to do something. Like there's multiple ways to get from A to B, and so the techniques that they're taught in vet school aren't wrong. Like you could do a spay neuter surgery. It's just that vets have learned and refined and adopted different ways in these techniques that will also get you from A to B a little bit quicker. And so and a lot of vets, I would also say that no two high quality vets you do exactly the same thing as far as these, high volume procedures go. And so I don't know if this is a great answer, but it's just kind of, you learn the standard, you learn one way to do it. And then as you get better and better and better, you can refine and go from there. And so you master, your basic bike riding skills, and then maybe you start learning a trick or two, and then you
Mhm.
start learning how to, branch out and go from there. But that would be my take on it.
And so what we're
Excellent.
hearing from the Vet Shortage Task Force is that students aren't taught clinicals until the very end of their vet school career, and that they might only get 1 or 2 spay neuter surgeries done. So that's why the internships and the externships are so important, because they're graduating, they're not feeling comfortable with spay neuter, so they're certainly not going to feel comfortable with high quality, high volume spay neuter.
That makes sense. So there's a couple of people who have mentioned this article that's come up that the AVMA has put out saying that there's no dire shortage of veterinarians anticipated in the coming years. Have you seen this article, and do you guys have commentary?
Yes, we've seen the articles. I mean, there's more than one. And yes, we have comments. I mean, all you have to do is Google vet shortage, and you can see the people who are clamoring for more vets. Even groups like the Animal Policy Group, they represent larger corporations like M&M Mars, the largest holder of veterinary clinics in the United States. I believe Banfield might be on their list. I mean, these are big veterinary practices that are clamoring for more vets. So yeah, all you have to do is Google and you'll see the opposite. And so why the AVMA continues to say there isn't a vet shortage is just mind-boggling.
Bree, do you have anything to add, or are you?
I mean, I think Cheri said it well. I think you heard the experience of our state leaders around the country earlier, how many of them have said, if we had a full-time vet, we could do a lot more. And that's not just our state leaders, that is basically everyone I talk to, especially going through this, wet lab outreach that we're doing to get those trainings in place. I think anecdotally, folks in the audience probably feel the same way. And I think the numbers of, that Cheri reviewed of having, where 7,000 vets are leaving every year, but there's only a finite number to replace them coming out of vet schools because there aren't enough vet schools. Graduating classes aren't large enough. So even if they're opening up a vet school this year, then they still have, years to go before they graduate and get out into the workforce. And so anyway, we just have the math doesn't math.
Fair enough. So if you do want to host a training, or if people want to get more involved, how would you suggest that they get in touch with you? What do they need to look at? What's your favorite page on the website for that sort of information?
And so my favorite page is we have a wet lab landing page. And so that is in your quick links. If you go to unitedspayalliance.org, there's a tab that says what we do. And under there you can find the listing for high quality, high volume wet labs. And so that's going to be like the landing page. We have some materials on there that are like sample documents that we have put together up to this point for folks to review to see if this is really something that you want to do. And then you can always get in touch with me directly. And that's, I think my email is just Brianna at unitedspayalliance.org. You can get in touch anytime. And I love having phone calls to chat about, whether or not this is the right step for you guys and if we can work together to make it happen.
Excellent. Moving to some international questions, are other countries experiencing the same shortages you guys are finding here? And if you were to recommend somebody in a foreign country that wanted to get rolling on, they call it an SNR initiative, how would you suggest they do that? Big question.
So, yeah.
We say that it's a nationwide vet shortage, but we know it's international. So I'm going to let Bree answer the other half of that question.
Yeah, I know during COVID especially, I was seeing vet shortage articles coming out from all over the world. And so we know that it is not just US focused, but that is our focus. But on the piece of, and I think it's like getting started with a SNR or TNR program in your community. Is that the question?
Yes, yes.
Okay. And so I would say, one of the best ways, if you're looking specifically for a program that is going to be backed by like the city or county, you know, with some support there, it always helps to look around, you know, at your neighbors. Is there a neighboring city, neighboring community that is doing it? And get their numbers, get their shelter stats of before this program was implemented and after this program was implemented. And if you can tie that in with the cost of sheltering, with the cost to round up feral cats constantly and whatever is currently being done with them versus what could happen with a TNR program, and like having a low cost surgery and being returned to field is going to be a lot cheaper than holding a cat that you cannot adopt out in the shelter for multiple days. And so I would say see who in your area you can compare to. Counties love to compete with one another. I would say if a neighbor's doing it better, then I'm sure your county will want to get their act together as well. So that can be a good place to start, is always get those shelter numbers and see if you can run the numbers. The money numbers are very convincing to county folks.
Always. they they definitely, you need to find what they are, what's going to affect them, and it may not actually be the cats, even though it's your, you know, personal goal. Speak to them in their language.
Yes.
Have you guys seen data that experienced vets are retiring sooner at a younger age, or because of corporate acquisitions? Like, what is the dig down into why those vets are retiring?
We're hearing that they're burned out at corporate, and we're hearing that. So, you know, when a pet owner comes in and they've got a sick pet, but they don't have an appointment because there aren't enough vets, that, you know, they're crying, they're mad, they're angry. So we're hearing there's just a lot of burnout from that side of it, and that they're leaving and going into other professions.
Mm-hmm. Interesting. Let's see. There's a lot of commentary in here from a lot of vets talking about what their training was like, which is very interesting. I don't know if I should share it, but it's it's interesting what people have learned in college or haven't. So there's some questions in. I'm going to read this verbatim. Unfortunately, the attitude of our animal control government agencies in their area is that feral cats, dumped cats are like wildlife. They will survive. Can you speak to that in terms of their spay neuter services and the need for that?
So I would say when it comes to cats being a part of wildlife issue, sometimes it's easier to remove, and I don't know, Kristen, you could probably answer this as well, and Cheri, welcome to tune in, but like where my mind just immediately went when you read that question is that, well, if we're not going to even view cats as cats, then let's think about the public. And if we have to go at it from the angle of spay and neuter and TNR comes with that rabies vaccination, which is going to protect the public. And so when it comes down to it, it's a public health issue. Do you want to have that, you know, herd immunity with the cats who are vaccinated in your community, or do you want to run the risk of, you know, not having that there? So, I mean, sometimes it feels weird to like pivot like that and not consider the cats. But again, if you have to speak their language, then let's try to speak their language, meet them where they are.
Mm-hmm. Definitely, the
And
public health angle. Oh, go ahead. So sorry.
So the other thing we're hearing is that, you know, people want to spay and neuter these cats and they want to take care of them and they're willing to invest. And so, you know, some communities simply don't allow TNR, or they don't allow feeding of outdoor cats. And so Indiana, we came up with a guide for elected officials so that they would fully understand community cats and the benefits of spay neuter. And so, Bree, if you would like to share our guide, we're happy for other states to write a similar guide. We know Ohio has one, and I met some folks from Missouri a couple of weeks ago and sent it to them. But I think every state should have a guide where you can speak to your local town managers, your local mayors, elected officials, to let them know why it's important in your state. And not like, so in Indiana, if I had a guide from California, they would just laugh at me because we're different. So the Indiana guide is very specific. It has quotes from animal control officers from one part of the state, a shelter from another part of the state, and then it's got cost numbers as well. So I think it's important to take a look at that and create your own guide.
Excellent. Bree, where can people find that document?
I can make sure that you get it, so it's in the handouts for sure. And
Awesome.
somewhere,
I can do that.
I think we have it on our website, but I can't quite recall offhand where that would be. So I'll make sure that Kristen has it for the handouts in the recordings.
Excellent. I will do a little poking around too while you're on your panel conversation, see if I can find it. Let's see. Just a suggestion on the spay neuter front from somebody in the audience that wildlife conservationists lose their minds when you suggest feral cats are wildlife. So that is definitely a place of common ground that you can find in with those public officials. The birding community also wants to spay and neuter these cats. So go ahead and get them on your side. Um, in terms of corporations becoming more of a part of the veterinary landscape, how does that affect affordable spay neuter for the general public? Has it had a positive effect in that it comes down? Has it had a negative effect in that it goes up? Is it making it more accessible to people? Just speak to that corporate buying of smaller clinics, if you would.
We're hearing that it's making it more expensive. So when you have a business, you have to pay everybody, you have to buy insurance, you have to get your parking lot fixed every once in a while and put a new roof on your building. But when a corporation buys you, there are a whole lot more people to be paid, and so the prices go up. And that's what we're hearing, and that's what we're seeing.
Okay. How are veterinarians reacting to this as well? You do see a lot of smaller vet clinics being sold to larger corporations lately. I don't know if that's just anecdotal or if that is actually true. But do you have that data?
We don't have specific data, but we do know that the corporations are buying vet practices with at least 2 vets because they are afraid one will leave. And I believe that they have contracts. We're hearing that they have contracts to keep the vets on staff for a number of years. And then we're also hearing that they're purchasing these practices in more affluent areas so that they're likely to be more profitable.
This makes sense. Well, it makes business sense. It doesn't make affordable spay neuter sense, but in closing, I don't see a lot of new questions coming in, but I would love to know what every person in this audience can do, one thing that they could start working on tomorrow. If you, in a perfect world, could just assign everybody a task, what would that task be? What are the best things that we can be doing to create more affordable spay neuter and more accessible spay neuter in our own communities?
I would say to find what it is in your community. And so is it going to a vet and asking them to, the lowest hanging fruit, and I'm going to steal this directly from Stacy. She talks a lot about like that neutering, like get a neuter competition on, right? Like, so like neuter November and ask like 3 to 5 vets in your community to like, hey, can you neuter 100 cats in November, and like have a competition to see who can neuter the most cats. Like, see what you can do to encourage vets to do more spay and neuter, even if it is a quote unquote lower hanging fruit, because it can have an impact. And I would love you to go out there and start planning a training to get more vets trained and, get them fully on board for high volume spay neuter, but we know that it starts with a small step. And so maybe that small step for you is just picking up the phone and calling a local group and saying, how can I help? Maybe it is spreading the word about low cost spay neuter services, or maybe it is seeing if you can challenge, your community to step up and create more spay neuter opportunities.
Well said, Bree. And I will echo what Bree said, is increasing spay neuter capacity. So the vets that are on this session and in the conference, it would be wonderful to have you get more involved, get the training that you need based on the comments that I haven't seen, but from what I've heard about vet schools, not really giving students much time with clinicals. And a lot of vets really do want to do clinicals. And Kristen, you asked, why are they leaving? And I think some get in to corporate practice and they really, wanted to become surgeons. They wanted to spend more time, hands-on with cats and dogs.